In this video, I'm going to discuss a Medicare decision that, if you get it wrong, can cost you over $10,000 in a single 12-month period. Coming up next on Holy Schmidt.
Holy Schmidt!
If you're new to the channel, hi, my name is Jeff. I'm a CPA turned author turned public speaker. I'm also the creator of the course Social Security Simplified. I started this channel in 2020, really at the request of my daughter. She saw me helping out family members with their finances, giving them great financial advice, and she said, "Dad, if you can help them, can't you help others as well?" And with that, the channel was born. Today, we have over 400,000 subscribers, over 60 million views, over 5 million hours of watch time, and we would love it if you join our YouTube family. Simply click subscribe and turn on notifications, and you'll get alerted the next time we post a video. We post 2 or 3 times a week. There's one Medicare decision that, if you get wrong, can cost you over $10,000 in a single 12-month period. And that decision is about premium, not about structure. The choice between Medicare Advantage and original Medicare plus a Medigap plan determines your exposure in a single year. And understanding what can happen in a bad year is what Medicare planning is all about. One plan will offer zero premium. Another will say higher premium, but financial flexibility. Still, another plan will offer dental, and one will say that you can go anywhere. It feels like you're comparing apples, oranges, and chainsaws. And here's the real problem. The damage that can be done by choosing the wrong plan doesn't happen on day one. It happens 3, 5, 10 years in the future when you need the plan the most. When everything is fine, almost every Medicare plan feels the same. You see your doctor, you fill prescriptions, and then you move on with life. But Medicare isn't just about routine years. It's also about bad years. And in bad years, you really stress test what your plan can do to keep you healthy and keep your costs down, which is extremely important when you are in retirement, of course. Medicare Advantage and Medigap plans aren't just different types of plans. They're a completely different risk to you. With original Medicare plus a supplement, you're paying a higher premium, but you're also minimizing unpredictable medical costs. With Medicare Advantage, you're paying a lower premium, but you're accepting a lot more medical variability and cost variability. One is a prepaid cost model, prepaid risk model. The other is a pay-as-you-go model. Under original Medicare alone, there is no maximum out-of-pocket cost, and that surprises a lot of people. So you need either a Medicare Advantage plan or a Medigap plan to make sure that you don't have unlimited out-of-pocket costs. With the Medicare Advantage plan, there is a maximum out-of-pocket limit, and that's between $4,000 and $8,000, depending on the type of plan that you have and the location in which you have that plan. Under a Medigap plan, say Supplemental Plan G, there's a very small deductible, and then all approved costs are covered at 100%. So the real question isn't which premium is lower, it's how much variability am I willing to accept in my medical expenses in the future. If you want to smooth risks and eliminate surprises, then a Medigap plan is appropriate for you. If you're willing to accept the higher risk of excess medical charges, then you might want to consider a Medicare Advantage plan. That structural difference is what drives every other downstream Medicare decision. Speaking of Medicare, gang, if you're approaching 65 or you're currently on Medicare, Medicare decisions can be overwhelming. Even people who do a lot of research often get it wrong. Just ask anybody who's 65 years or older, and they'll tell you that this is true. On this channel, we work with 3 affiliate relationships. One is our trusted Medicare partner chapter. And the fact is, many Medicare agents will push Medicare Advantage plans even if they're not right for you. But chapter will walk you through the pros and cons of all of your decisions. They won't push you into a plan that's not right for you. And importantly, they will walk you through all of the detailed information that you need to make the right choice for your specific situation. Chapter is very easy to work with. They're totally free to you. They save their clients an average of $1,100 per year, and it takes about 20 minutes of your time. If you'd like to talk to them about your Medicare options, give them a call at 440-703-1224. Original Medicare plus a Medigap plan will allow you to see any provider in the country that accepts Medicare, and that's 95% plus of the providers out there. There are no networks, no providers going in and out of the networks, and no geographic restrictions. Medicare Advantage plans operate within a provider network. That means doctors, hospitals, and other providers. And if they're in the network, you have access to them. In routine years, this doesn't matter much. In complicated years, it matters a lot, particularly if you're looking for specialty treatment outside of your region and outside of your network. There might be a great provider outside of your network that you don't have access to, for example. Again, this isn't about good or bad, it's about structure. Many people think that they can start off on a Medicare Advantage plan and switch to a Medigap plan later. This isn't guaranteed in most states. Outside of your initial enrollment period, switching from one to another may require medical underwriting. And the fact is, when someone's considering switching from one to the other, it's because, oftentimes anyway, they have a medical condition that has presented itself and they need better coverage. So it's a catch-22. This means that pre-existing conditions can affect eligibility and price, and this is one of the least understood aspects about Medicare. The choice you make at age 65 may limit your flexibility at age 75. Medicare Advantage plans reset their maximum out-of-pocket every January 1st. This means that in a year that you have heavy medical usage, you could span 2 years and have 2 sets of out-of-pocket costs. Medigap plans don't operate on an annual out-of-pocket structure in the same way. Once Medicare approves the charge, a Medigap plan will follow Medicare's structure, and this makes for a smooth experience for most people, particularly in years where you have serious conditions that have to be paid for. And gang, it's easy to compare a plan that has zero premium to one that's $150 a month or $200 a month, and the answer might seem obvious, but oftentimes it's not. The total cost includes premiums, deductibles, co-pays, co-insurance, and maximum out-of-pocket costs. It also includes opportunity costs, stress, and administrative friction. The lowest premium plan isn't always the lowest cost plan over time, especially in retirement, where cash flow, measuring your cash flow and how you spend your money, is of paramount importance. Now, let me be super clear on this. A Medicare Advantage plan is absolutely the right choice for some people. It makes sense for their specific situation, and they understand the plan, they understand the risks, and they're willing to accept the risks, and they've actually put money aside for the risks. If your doctors are in the network, if you don't travel extensively, if you've put money aside for the additional costs if necessary, then a Medicare Advantage plan might be right for you. Some Advantage plans have dental, hearing, vision, and a prescription drug plan all bundled into one. For people who value simplicity and all-in-one coverage, this can be very appealing. And in some counties, the maximum out-of-pocket costs can be significantly less than the ones we're talking about here. But the point isn't that Medigap is good and Advantage is bad. It's making sure that you understand your risk tolerance and to make sure that that fits within your retirement lifestyle. Let me give you a specific example. Imagine 2 retirees, friends in fact, both turning age 65, both healthy, full of energy. They both go on Medicare. One goes on a Medigap plan, one goes on Medicare Advantage plan. And for 3 years, nothing happens. The one who chose a Medigap plan is paying $180 a month. The one who chose a Medicare Advantage plan is paying $0. 3 years go by and nothing happens. The one on the Advantage plan feels validated. Lower premium, same doctors, no issues. Then in year 4, a complex medical condition happens to the person who's on the Medicare Advantage plan. This happens in October. Suddenly, treatment schedules, specialty referrals, hospital access, and a whole host of other medical issues are front and center, and this takes the plan from theoretical to actual. Then the same situation rolls into the following year. It's not all complete within 2 to 3 months, and they are continuing treatment during the first quarter of the following year. The person under the Medicare Advantage plan hits their $6,000 maximum out-of-pocket before December 31st, and then they hit another $6,000 out-of-pocket during the first quarter of the following year. That's $12,000 out-of-pocket during one of the most stressful times in this person's life. Under the Medigap plan, after a small Part B deductible, the rest of the medical costs are paid for. There is no financial volatility with the Medigap plan. Neither plan is wrong, but the emotional experience and the cash flow experience are completely different. And that one outcome is traced back to a single Medicare decision at age 65 that followed them for years to come. The number one medical decision isn't about dental benefits or a gym membership. It's about choosing the plan that you feel most comfortable with in the long run. It's about whether you want to prepay for certainty or accept financial volatility in the future. And once you understand that, every other Medicare choice becomes clearer. So how do you do this? First, evaluate your medical history honestly, not optimistically, but honestly. Second, ask yourself if you could afford a $5,000 to $8,000 out-of-pocket charge in any given year or any given 2 years. Third, consider how important unrestricted provider access is to you. Fourth, understand what your state rules are around switching. This is really important. Then run the numbers both ways and evaluate your risk and your likelihood that you're going to have a big charge in the future. If you like this video, check out that video, the #1 Social Security math mistake most people get wrong. Also, if you have questions about Medicare, don't forget to give our partner Chapter a call, 440-703-1224. This is Jeff Schmidt, and I will see you in that video right there.